You've been doing Kegel exercises forever and it sure seems like it's not working. So now what? That's the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Kegels seem to be a bit overrated. Not necessarily overrated because it's not important, but I think majority of people don't even know if they're doing it correctly. And let's be honest, it's not easy to do. And we can think of 20 million other things we would rather be doing than doing Kegel exercises. So then, you're doing 10 over here and, maybe 15 some other time. And over time, it's like, that thing's not working. So what do you do now? For one, Kegel exercise is not for every kind of pelvic floor dysfunction. So for example, a non-relaxing pelvic floor dysfunction, I've done a video on that very subject. We're going to make sure we're going to put it at the end of this video so you can watch that. But in case of non-relaxing pelvic floor dysfunction, we do not want to do Kegel. In my office, I don't even trust that my patients do the Kegel correctly. So unless things are ruled out, I have a machine called emsella chair that does 400 Kegels a minute. I don't have to guess if they're doing it correctly. The only difference between what I do and other offices do is I actually, every 5 minutes, we check the posture of the patient sitting and we're getting a feedback, and we constantly adjust the patient to make sure the session is being used effectively. But Kegel works on the certain muscles in your pelvic floor. Certain muscles is not all muscles. Certain muscles, or even all muscles, do not mean that whatever is connected to the pelvis is connected properly and is moving properly. So for example, if my hand is moving this way, everything in my arm is going to be going along with it. If my arm is going this way and I'm going to go this way, I'm going to sprain or strain my muscles or my joint here. A great example is when you're going forward and your foot doesn't, so you sprain your ankle. That's a great example of body going in one direction and a part of the body not going like it was supposed to. So when it comes to pelvic floor, what is happening is we're doing exercise like Kegel to strengthen a portion of these muscles without really addressing the connections. We're looking at the floor of a house, but we're not paying attention to the room itself. Are the walls steady? Is the ceiling steady? Is the floor steady? So the reason you do pelvic or Kegel exercise, but it's failing and it's not working, is because more than likely a lot of other things that needed to be assessed first did not get assessed. We seem to not pay attention to the alignment and the movement of the joints when it comes to pelvic floor dysfunction. We jump in, address the muscle, and we call it it. Maybe we talk about breathing, maybe we have a couple of minutes or maybe a session with a patient on breathing, and we move on. And that's the reason why pelvic floor dysfunctions are not being addressed properly. And frankly, we have a huge number of people who have the issue as a result of our sedentary lifestyle. If you have any questions, make sure you use one of the methods of contact in the description box. If you have not checked out my website, do so. There's a lot of good information for you to check out. If you have not subscribed to the channel, make sure you do so. And if you need to make an appointment to see what your story is, I'm here for you. Until next time, take care.